views and opinions expressed do not necessarily reflect those of Access Fort Wayne, the Allen County Public Library, or any other supporting groups. If you'd like to produce a show, call us at 260-421-1250.
Good evening. I'm Dr. Rudy Cashman, neurologist, neurosurgeon, Fort Wayne, Indiana, for 42 years now, and I'm only 39 years old. Tonight is a very interesting completion of my discussion of migraine headaches. This is really part two, a very interesting and fascinating subject, I think, for you and myself, as 18% of women have migraine headaches, and about 8% of men have migraine headaches. So it applies really to a lot of people. So with that, let us begin our discussion and the prevention and treatments of migraine headaches. I'm going to review just a little bit of our discussion on the previous lecture and divide migraine attacks into four parts. Part one is you have a prodrome, symptoms that you may have for a day or two beforehand, and we will discuss what they are generally. About 30 to 60% of people get them. An aura, which is something that we treat visually or we can feel it, and that's about 20 to 40%. Then the headache itself, we will describe the symptoms of that. And the fourth part, the postdrome, what occurs for a couple of days after you have a migraine. So let's discuss the migraine prodrome. It's about 1 to 48 hours before the headache begins. And what are they usually? Food cravings, unusual cravings for food. Some have loss of appetite. Some have increased appetite. Some have severe constipation or diarrhea. They don't know why. It appears all of a sudden. It occurs for migrainists who have this regularly. They fully understand this. Their mood changes, depression, irritability, euphoria, optimism. I used to have a nurse that had migraines, and I could tell, frankly, by looking at her, that she was starting to have an attack. Some complain of muscle stiffness, fatigue, drowsiness, increased frequency of urination, excessive yawning, difficulty concentrating, some difficulty with their speech, thinking of the word, or even forming the word, called dysarthria. That's the first phase, the warning that a migraine may be coming. Other people, about 20%, have an aura phase. What does the aura really involve? Many of them are visual, very unusual things they will see. Shooting stars, missing part of the vision, forming pictures. If you look to the right of my PowerPoint, that is a mosaic vision out of Oliver Sacks's book on migraine headaches. And the patient drew this piece of art. And I'm going to show you some more of aura art. Very interesting. Some will have sensory dysesthesia and anesthesia that have crawling sensations, and some have loss of feeling around the face, especially in the lips, is part of the aura phase. And some will have unusual odors and have an olfactory odor. Other ones will hear funny things and noises that really aren't there. Some will have photophobia. You can't look at bright lights, and even fluorescent lights will trigger the headache. And some will smell unusual things and that are not even real. And some will have speech problems, and this is part of the aura phase. It's generally thought to be about 20 to 30% of the time, but Oliver Sacks thinks it's more like 40%. Very interesting. Here's an example of migraine art. Paintings done by patients. Really unusual and really beautiful. On the left bottom, you see a typical migraine patient who went to bed and vomiting his guts out. This is not uncommon. And really, you can find many of these paintings done by patients. And what about the headache phase? Now we went through the prodrome, we went through the aura, and now we're in the headache itself. Usually one-sided, 80% of the time, moderate to severe. They can be excruciating, like an ice pick in your head, and some are light. One patient said childbirth doesn't even come close. That's how severe it is. And they're pulsating generally, not steady. Steady headaches, usually stress headaches. Physical activity aggravates it. Light physical activity might actually prevent it. Nausea and vomiting, diarrhea are common symptoms during a headache phase. Many have vertigo and dizziness. Other symptoms in the headache phase include loss of appetite or food cravings. Most of them lose their appetite when they have a headache. Some have things running out of their nose, rhinorrhea. Others have things running out of their eyes, increased lacrimation. Some have nasal congestion. Some have hot flashes and chills. Some have dehydration or fluid retention. All of a sudden they gain 10 pounds with fluid. Don't know why. Inability to concentrate, become confused. An array of emotions, fear, depression, anxiety, irritability, and even total panic can occur with migraine headaches. Prodrome, that's after the migraine has been completed, which is usually 2 hours to about 72 hours. They usually don't last much longer than that. And they feel like a zombie or hangover. It lasts a couple of days. They can be sleepy or euphoric. What's the character of all migraine symptoms? Some things that they have in common. Throbbing, pulsating, or pounding 85% of the time. Like a knife or a hammer or an ice pick. That's severe. Lasts 40 to 72 hours. Many patients climb into bed, pull the curtains down, avoid the light, and just like that picture, and vomiting. Usually one-sided. Common during sleep. Some people will wake up out of the cold sleep, just wake out of sleep with a pounding headache. That's not uncommon. And nausea, vomiting, about 80%. 33% vomit. Other ones have nausea. Remember, we talked about photophobia, lights, phonophobia, when noises bother them. Osmophobia, unusual odors will bother them or produced by the headache. Ringing the ears is common. Pain is worse with exertion or heavy exercise. Light exercise, yoga, gentle walking usually helps the headache. Loss of appetite. Most people during migraine attack, they don't want to eat. And there are things running out of the nose, rhinorrhea, increased lacrimation. We talked about that characterization. Let's talk about the migraine brain. What is different about the migraine patient? And they have hypersensitive brain cells. No one knows for sure why that it occurs. After much reading, I would say Oliver Sacks believes that since the hypothalamus, where it's thought the headache begins, is close to the limbic system, that's the emotional part of the brain, that perhaps that emotions have a great deal to do with this, and I kind of feel the same way. And these brain cells react to any stimulus it finds displeasing. Triggers. We're going to talk a lot about triggers. So it's a neurologic disease that affects the whole central nervous system. And if I get done here today, you'll truly understand it. It's in essence, it's a seizure from the brain stem, from deep in the brain, is what the latest thinking about migraines are. Very fascinating. That's why as a neurosurgeon, I find this disease totally fascinating. And they talk about cortical spreading depression, the new science. It was first demonstrated in rabbits who had their skull removed. They could literally see that the brain was reacting, and they could, through isotope studies, find that appeared to be a spreading depression across the brain. And they have demonstrated in humans now through isotopes that starts in the frontal area and then goes to occipital cortex and then to the brainstem. These are chemical changes due to neurotransmitters, so serotonin, noradrenaline. The old theory was it was strictly vascular dilatation. They could see the migraine patient that the arteries were dilated in the scalp. They seemed inflamed and indurated, very tender. That was the old theory, that the dilatation of the blood vessels externally was the whole thing. Now they're finding out the problem is located in the brain, that this external part of it is just what causes the headache, but that's not the cause of it. So the blood vessels expand as a result of migraine. They're not the cause of it. What's involved here? Neurotransmitters, the proteins that jump from nerve to nerve that affect nerve conductions. Serotonin, dopamine, the feel-good stuff, norepinephrine. These are the neurotransmitters and some others. And its inflammatory response of the vessels causes the pain. Finally, the impulse ends up in the trigeminal nerve and the arteries of the scalp. They dilate it, they become inflamed, and that's what causes the headache. So it's super excitability of the brain. And we're going to trace the impulse, and this is a wonderful illustration of it is thought today that the migraine attack starts in the hypothalamus. That's that little ring we had there above the brainstem in the illustration. And part of the reason is that everything that seems to trigger migraine passes through the hypothalamic area. Your brain has in it what's called a blood-brain barrier, BBB. That protects the brain from poisons. Some antibiotics can't get in because of blood-brain barrier. But your hypothalamus does not have a blood-brain barrier, so your blood system flowing through there, anything you put in your blood can flow through the hypothalamus and affect it. The hypothalamus really is the Wizard of Oz of your center, the metabolic center. It relates your temperature, sexuality, appetites. It affects the autonomic nervous system. So everything seems to pass through there. It's thought the impulse starts there. Then the impulse from the hypothalamus then goes to the brainstem, the part of the brain just above the spinal cord, and that sends an impulse into C1, C2, 3, which is the tail end of the fifth cranial nerve, and I'll explain to you the significance of the fifth cranial nerve in a minute. Shuts the pain gate. No headache. Then a pain impulse shoots to the frontal area of the brain. Blood vessels constrict in the brain, and then the spreading cortical depression occurs, goes through the brain, heads towards the occipital area, and that's why you see those flashing lights, those scotomata, positive or negative. You're missing part of your vision. You see this art that we showed to you. But as it passes through the motor area, the parietal area, that accounts for the sensory changes that occur in the extremities, around the mouth, the weakness that you feel. Occasional patient even gets paralyzed from migraine for a period of time. So it is thought today that the migraine attack starts in the hypothalamus, the Wizard of Oz of your body, the metabolic center of your body, your brain's brain. Trigger levels versus threshold. This is very important. You know, they talk a lot about triggers, and we talked about on our last DVD that there are certain things that can trigger your migraine. We talked about them, of course, a lot of food items, coffee, wine, stress, flashing lights, loud noises, a tremendous number of triggers. And we always think, well, the coffee did it. I saw a patient recently having a migraine attack, and he stopped at Starbucks, had a cup of coffee, and the headache began within a minute. He thinks it's the coffee. What Dr. David Buchholz from Johns Hopkins believes, and many others, and I tend to too, that we have a threshold. If we exceed the threshold, the migraine starts. In other words, we can have 3 or 4 triggers building in us, no headache. In our illustration that I have right here, these illustrations on the right, drawn for me by Bonnie Manning, an illustrator, for example, shows the bottom one, shows that person is below the black line. He's happy, no headache. Now he's starting to exceed the black line in the middle. He's starting to not feel right, maybe a prodrome, maybe an aura. And now you see him on the third illustration above there. He's above the black line being the threshold, full-blown migraine. And the point is that it takes a number of triggers, probably not just one. An occasional headache could just be due to one, but many of our triggers pile up, and the last thing that we do, have that glass of wine or that cup of coffee or the cigarette, and we blame that one item as being the cause, when it is not. It's the accumulation of your triggers. And it's different for different people. Increase your threshold, no headache. Relaxation, stress reduction, walking, a massage. This can increase your threshold, much less likely to get a headache. So the triggers add up, usually not just one. but you give credit to the last thing you did. It was the coffee, it was the wine, when in reality it was probably 2, 3, or 5 different things that really did it. So the total level of triggers varies constantly from patient to patient, person to person. Stress, loss of sleep, what you ate, for example, are triggers that can add up. If you sleep properly, you can reduce the chances of a headache 50% at least. So there are definitely things you can do. So the greater the trigger load, the worse the headache. The more things you trigger in a few days' time, the worse the headache is going to be. And what are some rescue drugs? Let's throw those in there. You go to the emergency room, or rescue drugs you could use at home. Toradol is commonly used. They go to the Lutheran emergency room, and they use commonly Toradol with Compazine and Benadryl. Those are anti-inflammatories. And the Compazine stops the vomiting. The Benadryl makes you a little bit sleepy. And the anti-inflammatories and can be a rescue drug, quite effective if things are just out of hand. Try to avoid the emergency room. Remember our last DVD, we talked about that, because you don't want to wait online, you don't want to be kept waiting. Remember, you go to the emergency room, you want it written on a piece of paper, on a letter, what your doctor recommends for your migraines. That identifies you as a migraine patient. You don't want to be sitting 2 to 4 hours in the waiting area and you get a migraine. That is not compatible with proper treatment. You must be dealt with immediately. I try to avoid the emergency room, and should have narcotics available, but I use them frequently at home. You know, you should take things to prevent migraines. You could take abortive drugs like triptans at the beginning of the headache, and if still you get a bad headache, you may need to take a narcotic, but don't take them frequently because you become habituated, addicted, and you will get rebounds headaches. We'll talk about those in a minute. Headaches, some of them are light, some are moderate, some are just impossible to deal with, and you have to go to the emergency room. For the light ones, I try Tylenol, aspirin, ibuprofen would be appropriate drugs. Avoiding rebound. Rebound is a big item. This, Dr. Buchholz especially, makes a great deal of this, that many of the patients that I speak to, a lot of people think migraines are not controllable. Totally false. But the problem is most of them experience a rebound. I know somebody in my family, for example, that takes medication about 20 days out of 30. That's inappropriate. It's incorrect. Dr. Buchholz will get excited if you told him that. And she has headaches all the time. That's rebound. That is what is a rebound. Too many medications. It's like taking narcotics all the time for a pain problem. It sensitizes the brain, and next time the pain or headache is worse, now you take a bigger drug, and it's a merry-go-round that never ends. That never ends. And actually, you should take triptans, which are, remember, that we use as an abortive medication 2 days a month. 2 days. If you take it more than that, you could get rebound. Now, there are a few doctors that could say you could take it a little more often, maybe 3 or 4, but I try to take it only 2 days a month to avoid rebound. And only 2 days a week of non-triptans, okay, NSAIDs and Tylenol and Advil, Aleve, and drugs of this nature, no more than 2 or 3 days a week, or you'll rebound from them. And the headaches get worse. Others offer a little more liberal. If they give up on you, rebound may be the problem. She's got impossible headaches. They can't be treated. Odds are that's a rebound person, okay? And your doctor may not be able to resist your phone calls. You're suffering. You're going to call him. You're going to go to the emergency room. You can't help it. Fully understandable. But he must help you to resist taking too much medication, or you'll be a rebounder and accentuate your headache problem. There's a very fine line here. It takes a lot of judgment. It takes a lot of judgment. And occasional painkillers are normal. Occasional narcotic, normal. You need to have at home preventatives, abortives, and the rescue drug. So you can take care of these at work or at home. But you got to stay within reason. Make a plan and try all preventable methods first. And we will discuss the preventable methods shortly. Avoid victimization and dependency. That's the problem with a lot of migraine patients. They are literally victimized by the emergency room, their physician, and themselves. Too much medication. Too much medication. They're getting rebound. It may start as a quick fix and end up with addiction and rebound headaches. If you're addicted to narcotic, addicted to the medication, you will not get better. You may suffer through it for a month or two to get withdrawal from these medications, but then your headaches will be a lot better. And so you try to avoid victimization, guilt, and blame. Headaches are worse because of rebound. If you have an uncontrollable migraine problem, odds are you are suffering from a rebound, and you need to go to a person that understands headaches. Avoid victimization dependency. A quick fix may keep you from doing prevention. If you're using quick fixes all the time, prevention will not work. So you got to get away from those quick fixes of narcotics, withdraw from them, and then preventive things will work. Remember what I said? Quick fixes and prevention are not compatible. It's like someone come to see me with a non-headache pain problem. As long as they're taking narcotics, it's not going to do much good to go to the Mind Body Institute and practice yoga, relaxation, stress relief. Not going to work. The narcotics are ruling your mind. They're ruling your mind. And go to the route of preventative treatment. You'll be 90% chance of being successful. I think migraines, and I'm totally convinced, migraines can be prevented 90% of the time. It's huge. And the reason it's not in society today is many providers and patients do not understand migraine headaches. It's a very instant disease. Look at my 2 DVDs. It will educate you, and you will know exactly what to do. There's good news here. Treatment of migraines, if there are serious psychiatric issues, we need to treat the stress or psychiatric problems. Occasionally you need a psychologist, but at least treat the stress. Critical, the doctor must listen to the patient. You must take a history. I saw a patient just yesterday, had gone to the emergency room, got a CT scan, very interesting. I'll tell you her story later. Turned out that she was having menopausal migraines. If you took the history, you figure it out. She went through, frankly, through some unnecessary tests because of it. But fortunately, since I've been doing this reading and lecturing, I picked up exactly what she had. So some don't wish to get well. It's a way of life. Some people have headaches. They want to get better. This is how they're leading society around. That's how they get disability. That's how they lead their husband or wife around. That's how they lead their family members around. There are some people unwilling to get well, and you have to keep that in mind. That's not uncommon in medicine today. So you have to learn to identify that situation. It takes a wise provider to figure this out. For some, new choices need to be presented as being a better way of life. Rudy's Top 10 Migraine Preventers. Pay some attention to these, and you can get them off my DVD and our websites. Exercise a half hour daily. You just got to do it. If you have a migraine, that takes precedence in your life. If you have a lot of migraines, you got to put it as number one. You got to exercise half hour a day. Proper sleep, 8 hours a day. If you need to take a sleep aid, well, do so. And you may need to. I don't generally recommend sleep medication just to anyone, but a migraine is critical. You'll cut your migraines in half if you get 8 hours of sleep. Proper eating. Your migraine diet without triggers. Migraine can be triggered by sugar levels changes. So to eat 3 meals a day is important, and to watch the type of foods you're eating. If you eat a nutrient-dense diet, which is what I teach at my Mind Body Institute, for example, even for weight loss and cancer and type 2 diabetes, applies very well to migraines. It has the least triggers in it. There are going to be a few triggers in there. Somebody gets triggered by mushroom, for example. So you got to figure out a few things that wouldn't fit into my way of eating. In the book, The Secret of the Non-Diet, you could read. You got to eliminate those, but it has a lot less than any general diet. Drink 6 to 8 glasses of water daily. I think that's very important. Stress reduction is important. My 20 prescription for stress reduction on my website, cashmanmindbody.com. Read those 20, practice them from meditation to relaxation to exercising to visualization, imaging, all things that you can do to get rid of headaches. Strong social relationships are important. You need emergency friends. You get 2 kids and you get migraines, you need an emergency friend. If the migraine, you have a migraine attack, you got to go to a room, pull the curtain down, curl up in bed, and somebody's got to take care of the kids. You've got to have emergency babysitters available if at all possible. Same at work. You may need some help. These are not kidding around headaches, but you got to be prepared. You got to have a plan. Phone numbers on the refrigerator so people know who to call in case they're so severe you can't even make a phone call. I think spirituality and meditation are good techniques. They're part of stress reduction techniques. Spirituality secretes good neuropeptides, and you're going to be a lot less stressful if you have a spiritual leader or spiritual help. Frequently talk to your spiritual leader to help you. And music at home is important. Loud music triggers migraines, but gentle music is relaxing. It reorganizes your brain. It reorganizes your neurotransmitters. I have a stressful day. I go to the car. I turn the music on, and Rod Stewart is playing out this music, and I'm feeling good in 30 seconds. Do you think I'm going to get a headache? No way. I feel a lot better. And so I think music can be good, but not too loud. Supplements, magnesium, Q10, riboflavin can be helpful. And I would remember I said about medication, I want you to have available preventive medication. If a headache starts, I want you to have abortive medication and a rescue drug. If it's just out of hand and you didn't stop it with all the medication, you may need to take that narcotic, which you don't take frequently, so that you don't get rebound, that you don't get addicted to it, which is not uncommon, or develop sensitization to it, so that you have the medication available. You can't be stuffing around deep in somewhere looking for the medication. Your migraine medication must be lined up, ready to go, in a little bag that goes with you to work, that goes with you on vacation, it's with you on the plane. You always need it. That's part of the 10 migraine preventative things that I recommend to you. Emotional cost of migraines, which is tremendous. Put migraine health first. If you have regular migraine headaches, you got to put it at the top of the list of your life. Why? Because the headaches can be unbearable. It can so dominate your life that you must get a hold of it. A lot of people don't. You know, it doesn't appear every 2 months and they're just not ready. You got to be ready, okay? Otherwise, it'll dominate your life. Plan ahead. You need your emergency room prescription, emergency room babysitters. You must have available on a letter from your doctor that you get migraines, what medication they usually use. When they check you in at the emergency room, you present this to them. They got to put you in a room right away, got to turn the lights out, and keep the noise down. You can't be laying around in the waiting area if you got a migraine problem. Use my 10-step preventative plan. Have preventative abortive rescue drugs ready to go. Have a preventative and ready plan ready. No exceptions. If you do this, migraines are not going to dominate your life. 41% have difficulties with the family because of migraines. You know what I suggest? My 2 DVDs. Play them for the family. They're for your education, but let the family watch this, your children included, and your husband, so they understand this. This is, they may think it's just, oh, she's just stressed out. This is migraine headaches are something different than a stress and attention headaches. They are totally different. They can be very severe. Your family members need to be educated. I would play that DVD over the lunch hour, maybe at your place of work for your fellow workers so they know it. Maybe if you can convince your boss sometime because you're missing some work, tell them to watch one of the DVDs so he understands what your problem is. They might appreciate it. 23% have serious interpersonal relationship problems, spouses and friends. Friends are lost over this darn thing. So the more you educate them, the more they'll be understanding and be helpful to you. Educate yourself. If you watch my 2 DVDs, I think you're going to have a darn good idea what this is all about. And the recommended websites, which I'm going to show you in a minute, and great books I recommend. Oliver Sacks's book on migraines, David Buchel's book on migraines are very good books to read. Educate your family and educate your employer. You mentioned that. Educate your children. They would be less stressful and understanding, maybe. And your kids may get migraines. Remember, a lot of them are genetic. You must educate your spouse about migraines, and no kidding around problem. And if you need a second opinion about your migraine, if you suffer from migraine headaches and would like a second opinion on alternatives to treat the illness, you want to get this organized, see me in the office. My phone number is down there, and I gladly see you. Although I'm a neurosurgeon, I treat a lot of people for wellness. I like to be called Dr. Rudy, Dr. Wellness. Now I even like to be called Dr. Second Opinion. Okay, so I'd be glad to see you to help you. You need a loving provider. If you don't, it's a problem. That provider needs to listen to you. And let's talk about pregnancy and migraines because it can be a problem. Most migraines go away after the first trimester. Good news. But you're going to have increased problems that first trimester. Why? because you can't take all the medications because they can affect the baby. Don't take anything unless you clear it with your GYN, with your OB doctor, okay? No medicine unless they say okay. This is the real time to learn non-drug treatment, holistic methods of treating it, from relaxation to massage, and we'll discuss those in more detail, to stress reduction. And this is the time to really learn about it, because any drug you take, you expose your child to. That's a problem, although there are a few you can use. You'll probably have to bear more pain than usual the first trimester, okay? So a good walk, a good massage, some music, some relaxation, quite important, some holistic methods. Have a good plan. You can usually continue your beta blockers at preventative medication, okay? But get the okay from your OB, okay? I didn't say it's okay. Let him say it's okay. Talk to a nutritionist to improve your diet if you're having a problem. I'll read my book, The Secret of the Non-Diet. The few triggers you may have under that diet, eliminate those. There won't be many. It might be a citrus fruit. It might be a mushroom. But most of the foods that are nutrient-dense way of eating don't trigger migraines. Drink more water than usual, 6 to 8 glasses a day at least. Take a 30 to 45-minute walk daily. An acute treatment, ice massage, ice packs in the refrigerator. Have them handy. Remember, you have to have a plan. And before taking narcotics, get okay from your obstetrician. Okay, sometimes they're okay. Get some rest. Rest more than usual. Remember, good night's sleep, 50% reduction in migraines. Uncontrollable severe headache, go to the emergency room. I mean, occasionally, even with a migraine and something, I'll see a ruptured blood vessel or something, but maybe you need to go in there and get a rescue drug, and they'll check with your OB before they give it to you to be sure it's safe for you and your baby. Almost all headaches stop after the first trimester. Hey, great news. But don't be pregnant for 30 years. Okay. No more headaches till the baby's born. And then we have to treat again. Here's some websites, www.migraine.org, helpforheadaches.com, headaches.com, some other websites that you might like to use. And you can copy this down. They'll be on my DVD. Additional plans, tell your obstetrician about migraines you may be suffering from. He may know very little, or he or she may know very little about migraines. And you might offer the DVD for their office staff. They might appreciate it, actually. Minimum medications, dangerous to the fetus. Okay? If the fetus is abnormal born, you might blame yourself for the drugs you took, so don't do that. Avoid all known triggers. For my first DVD, you learn a lot about food triggers and different other things, atmospheric changes, some things you can't control, from stress to a glass of wine to whatever, things you want to avoid. Focus on prevention. If you focus on prevention, you're planning for the future, how you might better control your migraines after the baby is born. Exercise daily. Remember how important I said that was. 8 hours of sleep. Follow Rudy's migraine diet, Secret of the diet, avoiding a few triggers that might be on there. And stress reduction, my 20 prescription for stress reduction, which are on my website. Just hit stress, cash and mind, body stress. Those from meditation to breathing to exercise to meditative techniques to reduce stress are very important. Play quiet music. Remember, it can reorganize your brain very quickly. Reduce strain. Now, let's talk about it, triggers at work, because some of us have migraine at work because it's more stressful at work. I used to have a nurse that commonly was stressed at work and had a migraine. I could look at her, and frankly, and tell she was having a migraine, and I would send her home. And use a computer glare screen so that light doesn't trigger you. It's a good one. You look at a computer all day. Reduce stress in your life as best as possible. Look at my 20 prescription for stress reduction. Educate your boss and fellow workers. You might use my DVD. Get them to watch a little bit so they understand you. It could be helpful. Wear sunglasses to avoid the light triggers if you can. And I ask for a quiet space in the office. If there's a choice as where your space might be, pick a corner where it's a little more quiet, less noisy, less lights, less chatter. That can be helpful. Use a white noise machine to block out some of the noise if you can. Use an air filter machine to decrease odor. The girl in the next booth might be using perfumes that irritate you and trigger migraine. If it does, you may have a gentle talk with her and say, your perfume is triggering migraine in me every day. And you yourself, of course, shouldn't be using them. And drink lots of water. We talked about that. Keep preventative from abortive medication near. You got to take your little bag to work. You're preventative, you're abortive, and you trigger. You got to take it to work. Now, if you take a narcotic, tell the people there that you did this. You may need some help driving home, and they need to be aware. And eat regular meals. That's very important. Remember I said changing blood sugar may actually be the cause of the trigger of migraine. It may not be the specific food. It may be how that food affects the blood sugar. That's why I think my diet, my high nutrient dense diet, does not trigger migraines generally because it doesn't fluctuate the blood sugar much. That could be the real reason. And eat regular meals. Technology now allows us to work at home. At times, you may have an attack before you can go to work. Call in, say, hey, I'm having a migraine attack. Please don't abuse it, the situation, but occasionally you may need to do it. You need to educate your boss that might come up. But like I said, don't abuse it. So educate your boss and workers. Take a break now and then. It's important. Take abortive medications immediately. If the headache's starting, you got it in the beginning. Abortive drugs in the middle of a headache aren't going to work very well. As soon as it starts, you got to take it. Have rescue drugs available with you. Learn self-massaging techniques. Learn to relax and massage yourself, or maybe there's somebody at work you trust that can massage your neck and head a little bit. That's something that's helpful. And emergency work plans. Turn off lights and put your head down. Go home sometimes. Warn your boss it may happen. Get outdoors into nature. Look at the trees. Listen to the birds. Speak to the flowers like I do, and it can be relaxing. Use Rudy's 20 stress reduction techniques. Maybe out of those 20, you could use 10 of them on a regular basis, from deep breathing techniques to meditative techniques can be quite helpful. Here's an interesting illustration. This is an excellent illustration, really, of the migraine where it originates. You can see in the hypothalamic area, you can see the frontal cortex where the impulse comes from that causes vasoconstriction. Then it heads to the low right to the brainstem, and then the brainstem sends an impulse to the cervical area that opens the pain gate that sends an impulse to this orange structure, which is the fifth cranial nerve, and it has 3 branches there, the ophthalmic, maxillary, mandibular division. Impulse goes across there, and then on the left bottom you see the hypothalamus, and it releases neuropeptides and neurotransmitters, and that causes, see the red structure at the bottom right, and it causes dilatation of that blood vessel, and that's the headache. That dilatation of that blood vessel in your scalp, that's the headache. That vessel becomes inflamed and indurated, and you touch the scalp and it's sore as can be. And it may last for days. That's the cause of the migraine. So you can see this is a complex situation going on in the brain. Mask of migraine. It tends to present itself in very unusual ways. I'm going to tell you about an interesting patient I saw today. My patient's story. Saw a patient yesterday, comes in to see me with a CT in her hand, been in the emergency room, and she's telling me that she 2 days, there was a couple of days there where she had a strange sensation of tasting something unusual in her, and then an impulse spread to her eye, and the eye became red and dilated, and the drooping eyelid, and a funny sensation in the temple area, and then it stopped. What was this all about? They did a CT to her head, found nothing. But then it took further history. She's 50 years old, and she'd been going through the menopause, no menstruation for 2 years. And 2 days before she menstruated for 1 day, she developed these symptoms. So what did she have? Menopause, migraine. That's what she had. 2 days before there was change in the estrogen level, the headache began. That's quite typical of premenstrual or premenopausal migraine. You could call this a premenstrual migraine. And it never expressed itself totally because she menstruated only for a day. It was menopause time. And usually at menopause, migraines stop. Not in every case, but 70% of the time. So it's a great masquerader. I'm sure this diagnosis, this patient would have been missed by 9 guys out of 10. It's just I'm reading about it and very sensitive to it. And I thought, oh, that was great. And clearly that was the case. And so the headaches can be mild, severe, most of the time unilateral, but sometimes migraines are both-sided. And it switches, be right or left, and both-sided, and switching all the time. So it masquerades, and you could say, what is this, something different? And some have steady pressure. Majority have throbbing, remember, along with the pulse. They have throbbing headache. And we have migraine headaches. Some people have tension headaches, and some have mixed. Some have them all. They have tension headaches, they get migraine headaches, they get mixed headache. It can be very confusing. But I truly believe if you follow Rudy's 10 statements, 10 recommendations of prevention, you can eliminate 90% of this problem. But you got to make a plan and do it. And sinus headaches, you hear about sinus headaches. You know what sinus headaches are 90% of the time? Migraine headaches. Migraine headaches. Don't let them operate on you. Sinuses cause headaches very rarely from something going wrong in there. It's those nerves from the fifth cranial nerve that go through there are the cause of that headache. Most facial sinus, quote, sinus headaches are migraines. Misdiagnosed most of the time. Don't let them operate your sinuses for a headache. Even infected sinuses cause a pressure effect. You may have pus draining out of the thing, but generally does not cause a horrible headache. If you got a horrible headache, it's not your sinuses, it's migraines. Very important thing for you to remember. Many providers are not aware of that, and you have to be careful. The mask of migraine, let's continue. Symptoms change. They can stop anytime. You can have migraines for years, bang, they stop, don't reappear for years. Some end before they begin. My patient's story, remember, she never got the headache. She just almost got it, and it stopped. It has to do with the hormone levels in the blood, the estrogen level. And we talked about the 3 branches of the fifth cranial nerve, the ophthalmic, maxillomandibular division. Impulses go up that nerve and affect the arteries, inflame the arteries. That's what causes the headache. And they go into the upper neck. Migraine patients many times have neck pain. Just because you have neck pain, don't get fooled. That's the tail end of the fifth cranial nerve, the sacral end, C1, 2, 3. Can send impulses down there. They go over the cervical nerves, and you can have quite a bit of neck pain, actually. Pain in the neck with migraines, common. Sinus headaches, common, but they're migraines most of the time. Fibromyalgia. Now, this is very interesting. This is just my opinion. But having been done this business for 41 years, I see a lot of patients with fibromyalgia. Pain back here, shoulder pain, low back pain, sensitive muscles everywhere in the body. Very, very sensitive in the skin, very sensitive muscles. Trigger points. What does that remind you of? Migraines. It reminds me of hypersensitivity of the brain. They do biopsies, EMGs, never find a darn thing. I think that this is a form of migraine. I think is a real possibility. I'm convinced of it, that they've changed the neurochemistry of the brain. Remember, most of these people who have this, they're stressed out, they're anxious, they're depressed. They're depressed for a reason. They're anxious for a reason, because the neurotransmitters of the brain have changed. What's migraine all about? Serotonin, dopamine, noradrenaline. I think that's fibromyalgia. I think a very interesting point. I see a lot of it. Maybe you should be treated, and we do treat them with similar drugs. Some SSRIs, for example, work for that. And let's talk about menopause for a minute. There's decreased estrogen, so a lot of the headaches stop at that point. Most stop at that time, 67%. Remember, migraines related a great in women to estrogen, to luteinizing hormone, LH, and progesterone. And most stop at that time. Good news, 67%. Triptan's safe after that. Generally, we don't want to give triptans, the abortive medication, at that time. And we need to be certain the patient doesn't have cardiac disease, high blood pressure. If those are negative, you can continue to use a triptan. Otherwise, they're contraindicated. You notice from my previous DVD, vascular disease, hypertension are not compatible with taking triptans. Okay? Hormone replacement therapy, HRT, if you do that, there is a 50% reduction of migraine incidence. But is it safe? You know, you hear a lot about today taking hormones and the risk of cancer and different things. I'm going to make no comment. You just need to talk to your doctor about it. I don't particularly recommend it. I would use holistic methods of treatment and not take a chance on that, especially a chance of cancer, for example. But I just wanted you to know they can be cut in half by doing that. Some doctor might say, get a hysterectomy and get rid of your migraines. Doesn't work. 2/3 of the time, the migraines actually are worse. So don't fall for this removal of the organs. Okay. Now, premenopause, heading to menopause, some people last as long as 15 years. This is a real problem because that's when the fluctuating hormones occur. You're heading for the menopause. These hormones are going up and down all the time. That triggers migraines, so that could be a problem. You need to be ready for that. So they could increase heading for the menopause for a while. Constant hormone fluctuations, not good for headaches. Average age of menopause is 52. HRT replacement is controversial. Remember we mentioned that. Menstrual migraines. So keep a diary. When do they start? And write down the intensity, 0 to 10. 2 days before menstruation is when you start taking the abortive medications if you're not taking preventive medications. 2 days beforehand. Then you get a second headache, and that's when you ovulate. Not everybody gets both, but you may get both. You may get one at the beginning of menstruation, starts at maybe about 2 days beforehand, and when you ovulate 14 days later, bango, another headache. Watch out for that. Magnesium supplements seem to help this particularly, something to remember. Serena Williams, a famous tennis player, was misdiagnosed for 5 years, then was treated 2 days before menstruation with Fulva, which is a triptan, has worked very well for her. Female hormones and migraines, twice as likely to have migraine around the time of menstruation than normal. Starts 2 days before menstruation, usually about 71%. There's a wealth of scientific evidence proving that point. Let's talk about birth control pills and migraines a little bit. Birth control pills, many times that's the first migraine for the person. For some, it stops migraines. Others, it produces migraines. So you have to see what happens, okay? The cause, changing hormones level. Again, it's the hormones here at work. And role of female hormones, fluctuating estrogen is a problem. Fluctuating LH and FSH, follicle-stimulating hormone, luteinizing hormone, are the culprits. Menstrual migraine, perhaps 20% of the females have menstrual migraines. Before puberty, boys more commonly have migraines than girls. But at the time of puberty, it changes totally. And at menopause, for many, it's the last migraine. And you can contact us here at the Cashman Mind Body Institute, incidentally. And our phone number there is 260-436-2040. So let's summarize our 2 DVDs that we did here on migraine headaches. First of all, I think it's very important that you keep a diary. I think it's very important that you keep a diary. Write down for 3 to 6 months exactly what is going on with your headaches. Number 2, let's make a proper diagnosis. Let's make a proper diagnosis. And you need to go to a provider that cares about you. That you get a guy, when you walk in the office, who doesn't necessarily say, where do you hurt? He says, and what's going on in your life. Takes a detailed history, and maybe you could even come in with a yellow pad written out some long-term history to find out what's been going on in your life, to see if you can figure out what your triggers are, what your family history is of migraines. And remember, we spoke about once you have a proper diagnosis, then let's work on a preventative plan. Let's use these 10 things that I spoke about, and let's try to use some conservative measures. Let's do some stress reduction. Let's use the 20 prescriptions for stress reduction that I wrote about. And make a plan to exercise. Remember I said a half hour a day at least. Let's get a good night's sleep. Let's learn to eat 3 meals a day of a nutrient-dense diet. You can't be eating fat, salt, and sugar. It has too many triggers in it. Meat is a very famous trigger, especially smoked meat. Hot dogs, for example, smoked meat of any kind. Many cheeses, very trigger-prone things to do. And you need to keep a log and a list. Maybe you need to clean out and eat a very bland diet for a little while, and then start introducing foods and see if you tolerate them. And you got to remember that triggers add up, your threshold. See if you can figure out what your migraine threshold is to stay below that. Maybe you can get away with a glass of wine as long as you don't have other triggers, as long as you haven't been stressed out all the time, as long as you're leading a reasonable, stress-free life, and maybe you can get away with a glass of wine. It may work one time or another, and the reason might be is that other times your triggers, adding up, and preventative plans can be meditation and breathing techniques. Music can be helpful. Doing some yoga activity can be helpful. Some people try biofeedback is a good way. Acupuncture, other things that you can do. A good massage. To get a massage regularly is important. And then educate your family. I think that's important. Get them to watch my 2 DVDs or one of the DVDs at least to get some idea that you have a no kidding around problem. And maybe get your fellow employees or your employer to live up to it. I think if you practice preventative techniques and take preventative medication, some take beta blockers, some use SSRIs like Elavil, some use seizure medication, Topamax, Depakote. Remember I said this is a brainstem seizure, and a seizure medication can indeed be preventive. And then if that doesn't work for you, then to take abortive medications, the triptans. There's about 7 of them now, and you might find a favorite one among them. But remember, if you get vascular disease and you got heart disease and you got diabetes, these medications are not compatible with you. And then have a rescue plan available to you. That you go into the emergency room, or that you have a rescue drug at home. Your rescue might be getting in a hot tub or taking a hot shower. And you must, in your emergency plan, you've got to have available to you some phone numbers. Maybe put them on your refrigerator. Don't memorize them, because when you get a migraine, your memory may go to pot. And that a family member, you call this person to come in, take care of the babies, or someone to drive you to the emergency room. I personally think if you make a plan and figure out what your triggers are, and keep a diary of that, what your triggers are, and religiously avoid them, then I think you could reduce your migraine attacks tremendously. And remember, rebound. This is a huge problem. I think 50% of the migraine patients I see are suffering from rebound. They've been over-medicated, just like the rest of the pain community out there who don't have, say, pain from headaches. They've been over-medicated. They're addicted to narcotics, and you can addict it to other medication. When we talk about migraines, they speak about rebound. The more medication you take, you're more likely to have a headache. I never see the word rebound used for narcotics, say for a routine pain problem. I think what they're suffering from really is a rebound, where you need increasing drugs, and they cause a sensitization of the brain. And now they start on Vicodin, and then end up on OxyContin, and then fentanyl patches, Diurgesic patches, and then it's on methadone, and the whole life is messed up. If this is your situation and you go into a pain center, and suppose you're a migraine patient, and now you're going to a pain center, and they want to constantly inject your neck, don't have it done. That's silliness. That is not going to cure this problem. You need to follow a preventative way, and obviously what a lot of them do to keep you as a permanent customer, they keep on injecting this area, in the neck area and the occipital area, and then, well, that works maybe for a short period of time because of a placebo effect. You think it works, and then the pain comes back, and it's, well, we can't give any more than 3 shots, so now it starts you on addictive medication. And the addictive medication causes rebound, and now you're a permanent customer. You don't want to be a permanent customer of the pain center when you got migraine headaches, because you're going to waste a lot of money, and it's not going to cure your problem. Prevention is going to cure this problem. And I followed the 10 steps that we spoke about, and eventually you could beat this thing. And migraines can come and go. You know, they can just disappear in a minute, and not appear for years. And you want to do something about it. You don't want to lead your life necessarily as a migrainer. I mean, some people have chronic migraines more than 15 days a month, but the majority of those are having a rebound, actually. They're having rebound. And you need to talk to a sensible provider that you can talk to, listen to, and if you find out, you know, they may not be as educated as you are. You watch my 2 DVDs, and I'll bet you 90% of the time that you meet a provider, you will know more about migraines than they do. I know. I didn't know that much about it, but now that I know a lot about it and took a great interest in it, I probably pick up 2 or 3 cases a week. I saw a patient recently. I've been following for 15 years for a brain tumor that keeps on recurring in this area, and he's doing fine. But he comes to the office a few weeks ago, and he's leaning against the wall, got his eyes closed, and he's having a horrible headache. But he always talked to me about horrible headaches on the left side of his head, and I always thought the tumor was doing it. But the tumor wasn't that big. I thought he was a sensitive guy. When he's coming here now, though, he's leaning back there, keeping his eyes closed, accompanied by his elderly parents. He's about 40 maybe. And I said, when did the headache start today? And he said, oh, about 5 minutes after I stopped at Starbucks. Hallelujah. He's having a migraine headache. And now finally, this chronic headache of 15 years, he called me the other day, he's not having any headaches. He was having migraines all along. And what fooled us, by coincidence, is that the tumor was on the left side, his headaches were on the left side, and frankly, he was a fooler. He's fooling me again. Now that, so migraine education really is not out in the community as much as I think that it should be. And remember, it's a great masquerader. I see it in children. Children will present times with abdominal pain, no headache. That's called migraine equivalent. I saw it in my wife's brother's child. They were at the lake the other day, and she's having migraines all the time. So I took a detailed history. As a child, I used to take her to the emergency room all the time with belly pain, all the time. Never could account for it. Finally, the operator told her she had torsion of the bowel. Well, I'm a little suspicious about that diagnosis of being something, you know, they made up. I wonder about it, and I really wonder, because she has a lot of migraines now, is that she had what I call migraine equivalents. That's a whole bunch of symptoms, but no headache. But yet, it originated in the neurochemistry of the brain. So what is migraine? Migraine is a neurological disease that affects the chemistry of the whole brain. It's a spreading depression. You can see my point about fibromyalgia. See what you think, because fibromyalgia is sensitization. It's about pain. It's about sensitivity. I think I'm right about that. And be sure now, in summary, to present, I want you to have a written down plan as to what you're going to do, what things you're going to do. I want you to be ready with prevention. I want you to be ready with abortive drugs, with rescue drugs, and I want you to be ready with phone numbers. And I want you to educate the people around you, your family, the husband, the wife, the children, your employer. I want them to know the problem that you have. And I think you can eliminate 90% of it. And a migraine will not dominate your life. Thank you very much for listening. I think you'll be helped a great deal if you watch these 2 DVDs. And I appreciate it very much. Namaste, and we'll meet again. Thank you.